Hello, thank you for joining us today. The intent of the story is to provide health education about the coronavirus for children and their families, as provided by Fort Defiance Indian Health Board, Healthy Living and Outreach Division. Our facility is built on the foundation of health, wellness, and tradition. You will hear about how we provide superior and compassionate health care to a boy named Ashki. Our story is about Ashki and his friend Josh, who defy the coronavirus safety precautions, which are staying home, covering your coughs and sneezes, staying 6 feet apart, wearing a mask, and washing your hands. After the story, you will hear Ashki and Josh answer questions from kids on Navajo. So stay tuned. Thank you.
Hello, kids. My name is Jennifer, but you can call me Jay. And I'm going to tell you a little story about the coronavirus. A Navajo medicine man told me to use the word Josh, or bugs, when I talk about the virus. It isn't as scary as coronavirus or COVID-19. So for this story, I will use the word Josh when talking about the virus. This story is about a boy named Ashki, who let his friend Josh into his house. Josh has been traveling all over the res, that naughty boy. He has been out of school since March, so Josh went to visit his friends and family across the Four Corners and even across the United States. Meanwhile, everyone else on the Navajo Nation has been staying home. Woohoo! And trying to avoid Josh. The only people who leave their homes are those who need to work, like those in hospitals, police officers, firefighters, store clerks, bankers, and so many other helpers on the Navajo Nation. All these people are doing everything they can to stay safe and to keep Navajo Nation safe. But not Josh. Josh has a bunch of names, like the virus, novel coronavirus, and COVID-19. The coronavirus is invisible, but it can visit anyone, rich or poor, old or young. Today, Josh is visiting Ashki down the road. Josh walks down the road, and he knocks on Ashki's door.
Hey, who is it?
It's me, Josh.
Yo, Josh.
Ashki, sup, bro?
Hey, man. What's good? Where's your mask?
I don't need it. Forget that. And forget this lockdown.
True that. True that. You can't lock us down. It's been a minute, man. Come on in. Hey, man. 6 feet.
Bro, are you serious?
Oh no! Stop, Ashki! You know better than to let Josh break the rules.
Where you been?
I've been around. Been all over. You know how I do it.
Dang, Mr. Traveler. What you do?
I took my ATV to the shop, saw my bros, hung out, chilled. Man, nobody was wearing masks. There was no signs. Everyone was just walking around. They didn't even have to stay home. It was cool, bro. I didn't have to worry about anything.
You doing okay, bro? Looking ill. Sounds like you're sick.
Nah, I'm good. It's just a cold. I just came by to play some games. I brought some chips. Let's play.
Let's do this.
I got you.
How'd you do that? What'd you press?
I'm not gonna tell you.
No way. Can't do that.
Can't beat me. Can't beat me. Oh yeah, Cheetos. You got some soda?
Yeah, bro, I got some. Let me get it.
Yadallah, Ashki and Josh have already been together too long, too close, and without masks. What else could go wrong?
Hey, man, go wash your hands.
Come on, man. Serious? I didn't touch anything. I just came from my house to here. Come on, have some, bro.
All right.
Ew, gross. Now Ashki has yucky snot all over him.
Hey, man, my mom's coming home later. We gotta finish up. We've been playing for hours, and I've got homework.
Hold on, man. One more level.
Bro, you sneezed all over me, and with the Cheetos, too.
Sucker. I got this. I got this.
Man, look at the time. You gotta go. My mom's gonna be back. She's gonna be jammed if I don't do my homework.
All right, I'm gonna head out. I'll catch you later, bro.
Thanks for coming by. Laters. Ashki, yadallah. Mom's gonna be so mad.
As Ashki was waiting for his teacher to log in, he started to think about how dangerous that may have been. What if Josh had COVID-19? Yeah. Oh, the teacher is online. Back to the story.
Yat esh ashchene. Today's lesson will be about coronavirus. We are going to learn about ways to keep ourselves healthy, and here are some steps we can all do. Step 1. Staying home. Not everyone needs to go to town with Che for hay and dog food. Step 2. Always cover your sneeze and cough. Step 3. Stay 6 feet apart from family and friends you do not live with. Family members can be Che, your aunties, your uncles, your cousin brothers and sisters. Step 4. Be sure to clean after yourselves. Wipe down all your TV remotes, your TV, your phones, the doorknobs, your game consoles, game controllers, and items you are always touching. Always keep your restroom outhouses clean. Step 5. Wear a face covering whenever you leave your home. Wear it when you are taking food to grandparents or other family members you do not live with. Step 6. Do not touch your face all the time. Just pretend you finished helping Grandma butcher, or you just ate a really greasy fry bread and you haven't washed your hands yet. Step 7. Wash your hands. Try to wash your hands whenever you can. That does not mean to use all Grandma's clean barrel water in one day, but wash your hands for 20 seconds with soap.
Ashki looked down at his hands, covered in Josh's germs and Cheetos. Gross. He had broken all the rules with Josh, but he didn't want to think about it. He told himself that everything was going to be okay and decided to grab sunflower seeds and a shashta pop. A week later, Ashki's mom took him to the hospital because he was feeling sick. He could tell she was worried.
Hello, Ashki. My name is Dr. Knudsen, and I am one of the doctors. How are you feeling today?
I don't feel so good. My head hurts and I keep coughing. I don't know what's wrong with me. I'm scared.
It sounds like you might have COVID-19.
Hati, what is that?
The other name you may have heard is coronavirus. It is a new sickness. It might make you feel like you have the flu. Some symptoms include your body aching, a cough, or a bellyache.
Some of my friends said it was dangerous for everyone, even my family. Is that true?
It can be dangerous, and therefore you might see some changes to keep everyone safe. These include things like staying home and not seeing grandma or friends, and also not going to school. But don't worry, adults are working hard to make things safe for kids. They are trying to find safe ways for you to return to school.
Is it going to be different when I go back to school?
Some schools may be online and others in person. If you go to school, some things may be different, including wearing a mask at school or only going to school some days. You may also have to sit further away from friends at school. Your teachers are working hard to make sure you learn lots. Some of the things that happen may also happen when you see family. Like when you go to see grandma, you may not be able to hug her and you may have to sit further away from her. You also may not see family as much as usual.
I don't want anything bad to happen. What can I do to help and stay safe?
There are lots of things you can do, like washing your hands with soap frequently, covering your face if you cough or sneeze, wearing a mask, and helping your parents around the house.
I'm scared. What do I do?
You can always talk to anyone at home, the hospital, or at school, but the very best person to talk to is a counselor. Let me have you talk to one of the counselors now.
Ashki realized his fun day with Josh may have been a bad idea. He hated being sick, and if his mom got sick, who would take care of him and his sister? Some of the doctors and nurses were dressed like it was the zombie apocalypse. Yeah, what was happening? Ashki needed to talk to someone about his thoughts and feelings.
Ya'at'e Ashki. My name is Luciana. I'm one of the counselors here at TMC. So I hear you're a little worried about being sick. How do you feel today?
I don't know. I'm scared about the coronavirus.
It's completely okay to feel that way. Many other kids and even adults feel the same way. I want you to know that I'm here to listen. So tell me what scares you.
Well, the doctor said I might have coronavirus. And she told me that I have to stay away from my friends and my family.
You know, Ashki, Getting sick sounds scary, but most kids only get sick a little bit. Like the doctor said, most kids say it feels like the flu with a little body ache and cough. So if you are sick, then you're not alone. You have your parents, your grandparents, and so many other adults here to help you. Tell me more about your worries.
I just don't want to get my family sick, especially my baby sister.
You're right. I don't want them getting sick either. I'm so glad you have adults at home that are there to protect you. Trust them to take care of you and everyone at home, even the baby. I need you to focus on yourself. Focus on washing your hands, staying home, and staying away from other people.
Am I ever going to see my friends again? My mom's always telling me not to let friends in, and I let Josh in because I wanted to play games. And Josh got me sick.
Ashki, you made a mistake. It sounds like you had fun with Josh, but for now, it's best not to play with friends. You can call friends or do video chat with them. Trust the doctors, and some of their helpers are working very hard to find the right vaccine for this virus.
Will things be okay again? Will Josh go away?
You know, that's a great question. We really don't know how long this will last. For now, all we can do is stay home, follow safety guidelines. Like what you learned from your parents, teachers, and doctor, I need you to know that your parents love you and we'll all get through this together.
Okay. I am still so bored at home. What else can I do?
It's okay to take walks outside, go to the garden, check on the sheep or horses. You can do some drawings, colorings, and even play board games. It's not good to watch TV too much because sometimes they talk about all that scary stuff. So limit your screen time and get outside.
How come there's no school?
Most schools right now will be done on video or online. This is done so people can be safe at home. You can stay safe. Kids can get sick at school, so it's important to keep everyone safe and keep them home.
Okay, I think I feel a little better now.
Good. I'm so happy to hear that. I'm always here if you need me or have any other questions. You can always ask an adult at home. Remember that you are not alone and there are so many adults fighting to keep you safe.
Ashki learned a lot from the doctor, and the counselor helped him understand his feelings. It's okay to be scared. Now he understood why his parents told him to stay home, wash his hands, keep 6 feet apart from others, and to wear a mask. I don't know if Ashki caught the coronavirus because that information is between him, his family, and his doctor. But we do know that Ashki never should have let Josh into his house. It's important to learn from Ashki's mistakes and keep ourselves, family, and friends safe.
And don't be a Josh. Stay home, stay safe, save lives.
Can my dog get the coronavirus?
Can your dog get sick? Funny.
Yes, your dog can get the coronavirus. This means we need to keep them safe too. To keep your dog safe, please keep your dog away from others. Do not put a mask on your dog and wash your hands after touching your dog.
Can coronavirus be spread through talking or breathing?
Think about when you cough or sneeze. Those little wet droplets of liquid that come out of your mouth or nose may have germs in them. Germs like the coronavirus. Like me, Josh.
Why is the coronavirus more dangerous to Grandma and Grandpa?
That's a good question. The truth is that anyone can get sick from the coronavirus. This virus affects the young and old, healthy and unhealthy, rich and poor.
Can I visit my grandparents, families, and friends?
At the moment, if you plan to visit someone, remember to wear your mask, maintain a distance of at least 6 feet or more, wash your hands for 20 seconds, utilize hand sanitizer, and if someone is sick, they need to stay home. We highly encourage people to visit their grandparents, family, and friends by giving them a phone call or FaceTiming them so we can all be safe.
What is a virus?
Oh, it's nothing. It's like my cousin or something.
Anyways, a virus is a tiny germ that is so small we cannot see it without a microscope. If a virus gets into your body, it can make you sick.
In reality, I can get you sick. So use your safety practices.
Why are you wiping down everything with wipes?
Well, we wipe things down to keep them clean from germs. And make sure you wipe your face too.
Why can't I have a birthday party with my friends?
Oh yeah, party time. That's what I'm all about. Yeah.
Whoa, wait a minute. You'll still have your birthday. Many people are having smaller virtual birthdays. There are lots of fun stuff to do with your friends, like having a Zoom party and making birthday deliveries.
All right. Just remember that we need to follow the rules, to tell families to stay away from others until the risk of getting the coronavirus is under control.
Why do some people get the coronavirus but don't feel sick?
Doctors and researchers believe that some people have stronger immune systems, like kids who eat good food, drink lots of water, exercise, and keep themselves healthy. It is elderly and people with underlying medical issues who need to keep extra safe.
Why can't I go to school or see my friends?
You don't need to go to school. Look at me.
Come on, dude.
Just kidding.
Scientists and doctors believe that one of the best ways to stop the coronavirus from spreading is for people to stay home and avoid gathering in groups.
Yeah, gathering in groups spread germs, like me, especially at places like the park, where a lot of people like to touch the same surfaces.
We know it's hard for you not to see your friends or go to school. Instead, use technology to reach out to your classmates, teachers, family, and friends.
Can I go to the hospital during the coronavirus pandemic?
The hospital workers are working hard to keep the hospital safe for patients, workers, doctors, and nurses. They keep the hospital safe by cleaning counters and chairs, wearing masks in the building, and practicing social distancing.
When will the coronavirus be over?
Unfortunately, no one knows the answer to this just yet. Scientists are using math to guess when the coronavirus outbreak may be over. However, like other viruses and the flu, the coronavirus may stick around or come back each winter. Scientists are also working on the vaccine that could help prevent people from getting the coronavirus, similar to the flu shot.
If you were infected with the virus, you had treatment and recovered, can the coronavirus return?
Based on the family of viruses that the coronavirus belongs to, people who get sick are unlikely to be reinfected shortly after they recover, which is 3 months or more.
Why can't we leave the house? Why can't my friends come over to play?
Right now, there is a rule that families need to stay home for a little while and be together. That helps us and our friends stay healthy. I know it can be sad when we can't see and play with friends, but there are lots of fun things we can do together at home. Would you like to play chase or do a puzzle? Check out our activity guide for play ideas.
Thank you for listening. This education is for information purposes only and is not a substitute for medical services or medical advice. If you live outside FDIHB service area, please contact your local hospital or visit Navajo Nation Department of Health website, www.navajo-nsn.gov/COVID-19 for more information. This message is brought to you by the Fort Defiance Indian Health Board, Healthy Living and Outreach Division, in partnership with the Behavioral Health Outpatient Department, Pediatric Clinic, and Marketing Department. Thank you.
The mission of Fort Defiance Indian Hospital Board Incorporated is to provide superior and compassionate healthcare to our community by raising the level of health, hazon, and quality of life.